such tiny hands, such tiny feet. It's always a joy to watch little babies and watch them grow. A healthy baby is every parent's wish. But the preparation for a healthy baby and a healthy pregnancy starts very early and starts with healthy, nutritious eating habits and healthy weight among the parents. Women and men who are highly underweight or overweight have reduced fertility. Such women experience a higher rate of miscarriages. Women who are undernourished at the time of conception are more likely to have babies with a lower birth weight or lose their pregnancies. Imbalances in nutrition can have an adverse effect on the early development of a baby, and this could start even before a mother is aware of her pregnancy. So it is important to plan ahead and seek good counseling on diet and nutrition before planning a pregnancy, preferably 3 to 4 months before the intended time of conception.
Folic acid is a type of vitamin B which is critical in the development of the cells of the baby and especially in reducing neural tube defects. It is important to start on folic acid as soon as you are trying to have a baby and not only when you are pregnant. And stop doing so only when your doctor advises you to do so. This will greatly reduce the risk of a neural tube defects in your baby.
Smoking and consumption of tobacco is very harmful for the health of the mother and the baby in the womb.
Women who smoke have difficulty conceiving and are more prone to spontaneous abortion. Their babies have a lower chance of survival, and those who do make it are likely to be sickly and prone to respiratory diseases in their early years.
Women who smoke are 2 times more likely to suffer a miscarriage than women who do not smoke. It is therefore important to stop smoking once you are trying for a baby. This miscarriage is partly due to the higher number of abnormal embryos that is an effect of the smoking.
Smoking also raises the chances of preterm labor and prematurity of the baby. There is seen to be an increased risk of abruption placentae, which is a serious condition where the placenta separates itself prematurely from the uterus before birth. This can cause abdominal pain and bleeding from the vagina. Such an event can lead to danger and even death for both mother and child.
Passive smoking can also affect the growth of the baby in the mother's womb. It is therefore advisable that husbands and family members avoid smoking in the presence of the pregnant mother, or to better still, quit smoking altogether.
Similarly, excessive alcohol intake and binge drinking can lead to congenital malformation and mental impairment of the baby.
The consumption of street drugs such as marijuana, cocaine, heroin during pregnancy may lead to even more severe consequences.
If you're preparing for a pregnancy, it is advisable to consult an obstetrician as early as possible.
Especially so if you have any pre-existing medical condition such as diabetes, hypertension, epilepsy, anemia, etc. Women with these conditions can surely have successful pregnancies. However, if these conditions are well controlled before conception, a woman is more likely to have a smooth pregnancy and a healthy baby. The doctor will discuss your immunization history as well as your family history to understand the risks of any genetic problems. Some essential screening to be carried out before conception include a pap smear, screening for HIV, thalassemia, rubella, hepatitis B. A general gynecological examination can help to ensure the health and preparedness of the womb to accept a pregnancy. In some cases, a pelvic ultrasound is carried out to check for ovarian cysts or fibroids in the uterus, as these may affect conception and even the development of the baby in the womb.
Screening for thalassemia is also an important part of preconception screening. Thalassemia is an inherited blood disorder. Thalassemia is passed on from parent to child and can affect both males and females.
If any one parent has thalassemia minor, the child may have a 50% chance of having thalassemia minor and a 50% chance of being normal. However, if both parents have thalassemia minor, the child has a 25% chance of having thalassemia major, a severe form of anemia, which may lead to poor growth, development, and even a shorter lifespan.
There are a few vaccine-preventable infections, such as chickenpox, German measles, otherwise known as rubella, hepatitis B, that can result in severe physical deformities in the baby should you contract this infection during pregnancy. If you have not had any of these infections, or if you have not developed any natural immunity against these infections, then it is advisable that you should have vaccination against these infections at least 3 months before you plan to conceive.
Developing flu during pregnancy may lead to complications in some women, including high fever and lung infections. These may increase the risk of preterm labor and miscarriage. It may be beneficial to take a flu vaccine to prevent these complications. Every expectant mother looks forward to a smooth pregnancy and a healthy baby. The preparation towards this must start early. Healthy lifestyle practices, adequate care, caution, and following your doctor's advice before and during your pregnancy can make this dream come true.